Hi guys, slightly different setting. This is my nighttime setting with my little nighttime cap to keep my head warm. Now that these autumn days are drawing in. I just wanted to do a quick, hopefully, video. One of my friends basically asked if when I found my lump, that was the only symptom that I was having, whether there was anything else. Basically the answer is that was the only symptom that I was having. I basically just found a lump and that was it. There was nothing else. It actually presents a lot more like a fibroadanoma, I think is how you pronounce it, fibroaduda, which is has really smooth edges and like moves around. Like you can sort of move it around in your boob, and it's a lot more common in younger women, and it is benign, and I think pretty much all of the medical professionals were thinking it was that, and then it wasn't. So if anything, that is an advert for go get it checked, even if there's like one thing wrong or you think it'll be fine. It probably will be, but just double check. Yeah, but as well as lumps, you should be looking out for any like discoloration, any like dimpling in the skin, any like rashes that you might have if you have pain, if you have like constant pain in your boob or in your armpit. Look out for that. Basically any changes. If you start checking yourself regularly, you'll learn what is normal for you, and you'll learn if there's any changes that happen with your monthly cycle, because sometimes just before you come on your period your boobs will change because of like the influx of estrogen and hormones in your body. So get to know your boobs and what's normal for you, so that it's easier to know when it's not normal. I'll put a link down below. I'll put some information about the fibroadenoma just so you can have a read about that if you want to, and then I'll also put a link for the Copperfield charity, which is all about getting people to check themselves. I'm going to say people because guys, you should be doing this as well. When I went to get myself checked at the hospital, there was a guy there getting himself checked, so you know, don't rule yourself out. Don't rule yourself out for any reason. Again, I am like the poster girl for this because I am a lot younger than most people who are diagnosed. I've absolutely no history of cancer, well, breast cancer or any cancer in the family. It didn't present, the tumour didn't present as you would think cancer did, and there was like one symptom out of everything. Please check, and please go to the doctor if you find something. The worst thing that you can do is wait, basically. Yeah, waiting is not good because that is just giving it more chance to spread if this is what it is. There are like 100 things that it could be that aren't cancer. I think I know at least like 3 people that have been to the GP and it's turned out to be nothing, but you need to know, basically. Please don't, I know it's hard, but don't be scared or nervous about going. Everyone is going to be really professional. When I call to make the appointment, we have a system where they ask you what the issue is and you don't have to tell them, but I did, and although the GP I'm signed to is a guy, they automatically made me an appointment with a lady doctor. But even if that's not the procedure at your GP, I'm sure you'd be able to ask to see a female doctor if that was making you uncomfortable. You could take like a chaperone, essentially, so you can take in someone like a friend that you feel comfortable with, or a family member, or you can ask for a medical chaperone as well if you don't think you'll feel comfortable in the room with someone else on your own. The examination is really quick. If you do take someone else in with you, don't worry, they won't see if you don't want them to. They'll put a curtain round the examination bed. It doesn't last very long. Basically they'll probably sit you up and just take a look, just to check if anything's lopsided. That's something else for you to check for, because obviously very few women have really even boobs, but if you know yours, then you'll notice if anything goes amiss. And then basically they just ask which side the issue is on, if they can't see it, if it's not like a discoloration or something. Well, they'll probably still ask just in case that's normal for you. And then they'll start with the other side. And basically their check was much like the check that I used to do, which was like arm up and then just sort of checking all the way around, like quite a firm sort of touch, I suppose, firm press. If you make sure you sort of go right in, because you don't know where things might be lurking, and across your chest and also in your armpit as well, because this is where your lymph nodes are and they're likely to get inflamed if anything's gone a bit hinky. So yeah, showing a bit of shoulder there. And then arms down as well, and just sort of do the same thing, because everything's sort of moved around then. Basically give it just a good old grab. It's easy enough just to do in the shower, or if you have someone special that you would like to do for you, I'm sure you can ask them. So yeah, the doctor will just do that on both sides, and that's pretty much it. It's really quick. It's like probably like a minute, if that. Yeah, and then they'll probably probably refer you. They might do that even if they think it's benign, because they want to check it out. If you think that it's something that needs to be checked out and they say we'll just leave it, it's bound to be fine, you can ask to be referred. Don't let the doctor sort of dictate, because it's your body and you need to know what's going on with it. And I know it can be difficult if the doctor says no, it's fine, and you want that to be the answer, and I'm sure it will be the answer. But if you feel that you want to take it a bit further, push for that, because you're well within your rights to do that, and you know, better safe than sorry, basically. Yeah, I'll leave that there because that is long enough. But yeah, any more questions, I'm sure that the link below, Copperfield, has an amazing website. Go click on all that. They'll send you like reminders, and there's a little poster you can print out to see all the things you should be looking for that I've probably missed out quite a lot. But yeah, time's running on and you're probably getting bored. So yeah, basically check yourself, do it.